Hello, and welcome to a brief introduction of the National Trauma Research Repository. During this introduction, we will provide you with a brief overview of the National Trauma Research Repository, review the meta-study, review the recommended next steps, including navigating the website, the data submission request form, requesting an account, as well as provide you with additional information on who to contact with any questions or concerns. The purpose of the National Trauma Research Repository is to help advance trauma research by providing an infrastructure that enables investigators to access and use research data that have not previously been available. There are a variety of stakeholders involved in this repository, including the Coalition for National Trauma Research, the Defense Health Agency, among others listed here. The architecture of the National Trauma Research Repository, or the NTRR, mirrors what has been created for the Federal Interagency Traumatic Brain Injury Research Informatics System, also known as FITBR. Both FITBR and the NTRR are built on the Biomedical Research Informatics Computing System, or BRICS, platform. Through this collaborative approach, this system, the FITBR system and the NTRR system, will sit side by side and communicate with one another, and researchers can pull and reference data that exists between both, allowing for aspects of polytrauma to be explored through secondary analyses. There are a variety of BRICS modules that you can learn more about via the NTRR website, but for the purposes of this overview, we will focus on the meta-study and the accounts modules. To better understand what the meta-study is, we will first review briefly what the data repository is. So the data repository within the NTRR helps to manage study information, and investigators can contribute, upload, and store their research data here. The research data that is uploaded into the data repository is uploaded along common data elements and unique data elements. Data can then be queried through a query tool via the individual data element or a form structure, and then the query tool allows researchers to aggregate results across various studies. Researchers then send these data queries to the meta-study for storage. The meta-study can also be used to store and reference results and study data that are not presently in the data repository. So investigators can upload entire data sets in Excel formats or similar fashions, and then these studies here will not be linked to any common data elements or unique data elements within the data repository. So the meta-study ends up serving as a flexible data storage for primary and secondary data, and these items within the meta-study are assigned a meta-study digital object identifier, or DOI. This DOI is then cited across all future associated research publications using individual data sets that are accessed through the meta-study. Using the meta-study as a storage facility, there are some file types and size limits. Displayed here are those limitations. When uploading a study into the NTRR meta-study, investigators can upload their documents in formats that are such as PDFs, Word documents, and Excel files. The public access site is available now for investigators and others to view by going to ntrr.nih.gov. From this homepage, interested people can click Get Started, and this web page will outline all the steps necessary to get started using the NTRR. Section 3 here, download, fill out, and submit your forms, has the data access form and the data submission form linked. Upon clicking the hyperlink, you will be navigated to a PDF, focusing again on the data submission request for this purpose. This PDF, this document, then outlines the agreement for using the NTRR, the expectations, and then on page 8 of 9, It has the fillable forms for you to complete the data submission request form. Some aspects to consider when reviewing this form. Please ensure that subjects have been properly consented and that their de-identified data would be shared for research purposes within a repository. If there is an associated grant or funding agency with this dataset, please indicate the grant number and the funding agency. If there were no funding sources, please simply put not applicable. And with these forms, there will be a minimum of 2 to 3 signatures requested. So a signature requested for the principal investigator, the submitter, if that person is different than the principal investigator, and the institutional signing official. This signing official will vary from institution to institution, so please follow your institution's specific procedures for navigating a data use agreement, and this form would be very similar to that. Once you have decided that you would like to upload your data into the NTRR meta-study and you have reviewed this form, you can then follow these steps to begin using the NTRR. The NTRR login system is set up with the Researcher Auth Service account, so these steps will help to guide you through that process. Alternatively, you could click Login here and then follow these steps. As previously mentioned, the FitBur and the NTRR are both built within the Bricks platform, so the branding here does say FitBur, but it will also lead you to the National Trauma Research Repository. During the NTRR account creation process, you will be prompted to upload a biosketch or a CV and the completed data submission request form. So we do recommend that you have these two resources available when you begin the process. For you, the next steps, I would recommend to go take a look at the NTRR website, review the different features that are available. If you would like to submit data, please review, complete, and sign the data submission request form, and begin the process to create an NTRR account. Once the NTRR account has been approved, you may then go ahead and upload your data and all the supporting materials into the meta-study. If you have any questions or concerns, please feel free to reach out to the NTRR Help Desk via ntrr-ops at list.nih.gov or the Coalition for National Trauma Research via the email research@nattrauma.org.